Hi everyone! Welcome back to Health Angel Solutions. Today we're going to talk about how to tell if you're taking too much levothyroxine. For those who don't know, levothyroxine is a thyroid medication. In fact, it is the medication that is prescribed for low thyroid, so you need to be taking the exact right amount. If you're not taking the right amount, which means you're taking too much or too little, you will experience symptoms. The symptoms that you experience if you're taking too much levothyroxine are almost exactly the opposite of those that you would experience if you're taking too little. And most people are definitely taking too little. Although levothyroxine may be the right medication for you, it isn't always the case. I have a lot of videos explaining why levothyroxine may not be right for other people, why it doesn't work for most people, and so on. But there are some people in which it will work provided they're taking the right dose. If we looked at all the people who have thyroid conditions, most people are not taking enough, but some people still take too much. That's exactly what we're going to talk about today, the symptoms you might experience if your levothyroxine dose is simply too high. So that's what transpires. These are the negative symptoms you could encounter if your dosage is simply too high, which would suggest that you should lower it. Anger would be the first nonspecific sign. Now, thyroid hormone is kind of a Goldilocks hormone in the body. You don't want too much, you don't want too little, you need it just right. If you notice that your thyroid hormone level is too low or too high, you can start to get irritable. Fortunately, irritability is more often linked to the higher side of things. However, some individuals may experience if their dose is too low. We've included it here for completeness, but it's really a nonspecific type of symptom. So you can't just look at irritability and determine if your dose is high or low based off that alone. Another symptom that you may start to experience is hair loss. Okay, so hair loss can also occur if your dose is too low, but the hair loss that occurs if your dose is too high tends to be a little bit different, so you tend to start seeing the hair become brittle and you see it start to break. Okay, so if your hair is simply falling out, that is, if it just falls out when you shampoo or show off your hair in the shower, and it comes out in clumps and excess in your hands, that is more indicative of low thyroid side effects from hair loss. However, if your hair breaks and loses its original texture, color, or style, that is, if it becomes brittle and begins to break and crack, not just at the ends, it is important to note that levothyroxine can cause hair loss regardless of the amount taken. Therefore, it can cause hair loss regardless of whether your dose is too high or too low. However, if your dose is too high, you will experience side effects related to the hair loss itself. As you can see, the majority of hair loss occurs in the middle of the hair shaft and is typically caused by an excess of thyroid hormone, which can be obtained from levothyroxine. I understand that this may seem a little confusing, and hair loss is something that frequently occurs when it's too high. Anxiety is the next hormone on the list, so people who have too much thyroid hormone in their bodies often feel agitated and, paradoxically, tired. However, they have a jittery feeling and an anxious demeanor. They can also be prone to panic episodes, which can be brought on by an excess of thyroid hormone. Therefore, despair or experiencing slow, sluggish thoughts, that kind of thing, is more directly linked to low thyroid hormone dosages than anxiety, which is more closely associated with excessive thyroid hormone. It kind of goes back to what I was saying earlier when you're really pumped up and you have this sort of nervous energy, which is probably a good way to describe it here because you're nervous, because it's anxiety, and it's kind of a weird sense of energy. Another one is insomnia, so if your dose is too high, you're going to have trouble sleeping. But it's a different kind of jittery, nervous energy, one that makes you feel fatigued and unprepared to take on the world. And that nervous energy can result in insomnia, which makes it difficult for you to fall asleep. You may find it difficult to relax your body. Your heart rate may remain elevated, all of which are related to the difficulty in falling asleep. Thus, insomnia is unquestionably a side effect of having too much thyroid hormone or too much levothyroxine. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so If you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. The next one is fertility problems, which can also be caused by having too little thyroid hormone, which means your level of thyroxine dose is insufficient or too much now. Similar to irritability, muscle weakness is also very nonspecific and can also be associated with a low dose, so don't live and die by it. But be aware that an excessive dose of levothyroxine can cause some weakness. Women with a history of infertility who take excessive amounts of levothyroxine typically experience fast menstrual cycles. Thus, if you have hypothyroidism or a slow thyroid, you may experience a 40-day cycle. If you have an excess of levothyroxine, however, your cycle may drop to a 20-day cycle. This is considered rapid cycling, but it interferes with normal ovulation. Hormone cycles don't reach their peak and decline at the appropriate rates, and so on. It also interferes with the levels of estrogen and progesterone, which in turn accelerates the menstrual cycles. Therefore, if you have noticed, let's say for the sake of argument, that you typically experience a 30-day cycle, and you began taking levothyroxine, you noticed that your cycle was going for, rather than 30 days, 28, 25, and 22 days. This is sort of a sign that your dose might be too high and that it's affecting your menstrual cycle, which is affecting your fertility and ability to conceive. The next one is a rapid heartbeat. This is a pretty common occurrence and likely the first thing you'll notice. What's fascinating is that you might not even realize that your heart rate is fast. So I usually have patients take their resting heart rates before starting thyroid meds, especially ones that contain T3. I find it useful to know what my heart rate is the moment they wake up in the morning. If you have a tracking device, such as an Apple Watch or Fitbit, many of them are available these days, you can actually see how your heart rate changes when you start taking medication for thyroid problems. You can see whether it increases, decreases, or stays the same. This variation in your heart rate over time can help you understand how well your thyroid and your body are using the medication you're taking. In this instance, levothyroxine is being discussed, but this also applies to other thyroid medications. If you take too much thyroid medication, you will notice that your heart rate increases and stays elevated in proportion to the dosage you are taking. Ideally, the resting heart rate should be between 60 and 70, but if it starts to rise to 80 or 90 or even higher, you should assess whether the dose of your thyroid medication is too high. This is because you don't want your heart rate to be that high at rest. That is, when you wake up first thing, you aren't standing up and performing jumping jacks. You're just sitting up in bed and looking at your heart rate. And it should not be 92 or 93. That's just not where it should be. It should be almost at a low point, as low as it will be all day, first thing in the morning before you get up and do things like that. Excess levothyroxine is frequently linked to rapid heart rate, which is typically one of the first signs that you may experience. Palpitations are the next one, and these are not something that go unnoticed by everyone. Palpitations by themselves are not necessarily concerning. Okay, if you just have palpitations, it doesn't mean anything is wrong with your heart or anything like that. Okay, so you're not having a heart attack or anything like that. But like I said, they're very concerning to patients. And in fact, if you ever had palpitations, leave a comment below, because these can be very freaky to a patient when they experience them. It feels like your heart is beating out of your chest, all right. And I don't think it hurts necessarily. That's not how it's described. So they become terrified of them. The sensation of your heart palpating is all that it is, a palpitation. What's interesting is that, contrary to popular belief, palpitations do not necessarily indicate that your heart rate is racing. In fact, most of the time, when I say to someone who reports experiencing palpitations, I say, okay, let's check your resting heart and see where it is at. They check it, and it will usually be 72 or something similar. 75 or 74, whatever the case. The important thing to remember is that even when their heart rate isn't raised, they can feel their heart beating. Therefore, it's completely fine, but only in the sense that it's not dangerous. However, it may indicate that your levothyroxine dose is too high, so keep that in mind. The next condition would be diarrhea or just loose stools in general. This depends on your baseline level of gastrointestinal function. You'll need to determine where you fall on the spectrum to determine how often you experience constipation or loose stools. Therefore, the kinetics of your bowels will also be affected. To put it another way, this means that they will move and move more quickly. The more thyroid hormone you take, the faster your bowels move and the shorter the time that food remains in your bowels, which basically increases your risk of developing diarrhea. Alright, so it's proportionate to the amount. The larger the dose, the greater the likelihood of experiencing anything from constipation to diarrhea. It really just depends on the person. This includes loose stools as well. However, keep in mind that thyroid hormone speeds up the digestive system and your bowel movements. Lastly, and this is another very noticeable symptom that is unquestionably a sign of having too much levothyroxine, is heat intolerance. If you take levothyroxine and you experience flushing, sweating, or what feels like almost hot flashes, these kinds of sensations are all linked to heat intolerance. In fact, another good way to identify heat intolerance is if you are normally cold all the time and you feel like you need to remove yourself from the heat. You can't stand the feeling of heat on your body. Now, the majority of you listening to this will probably say, I love the heat. I need to be in the heat, which is a sign that you need more thyroid hormone because your thyroid hormone dosage is too low and your levothyroxine medication dose is too high. However, the opposite is true for those who take too much levothyroxine. They develop heat intolerance, which makes it impossible for them to be in a heated environment at all, including feeling hot air blow on their face or other body parts. Thus, these are all the signs and symptoms linked to overdosing on levothyroxine, the most widely used medicine for treating low thyroid problems, including hypothyroidism. This is all I have for you right now, but I want to hear from you guys. Have you experienced any of these symptoms? Do you think your thyroid dose is too high or too low? Are you experiencing these symptoms right now, or are you experiencing the opposite, which would indicate that your dose is too low? Please let me know. I also want to hear from those who have thyroidectomies and those who are post-radioactive iodine ablation. Please share your experience with me, and if you have any questions, please leave a comment below, and I will try to respond as soon as possible. In conclusion, if you're experiencing any of the symptoms we've discussed, it's important to consult with your healthcare provider to determine if you're taking too much levothyroxine. Adjusting your dose can help you manage these effects and restore balance. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to Health Angel Solutions for more insightful health tips and advice. Stay healthy.